Hey. Okay, so rather than just talking about random things while I wait for Esther to come on, I actually have some very exciting news for everybody. So we're going to fill you in more, but we are now, Project Proactive is now an official nonprofit organization. We're very excited about it. And in honor of that, Shoshana is sponsoring the live in honor of all of you who have, kind of been there with us through everything and through all of our growth. And we are going to go live a little bit later on in the week to kind of get your feedback on, where you feel our next moves should be and really make this a community project because it really is all about you and, we really want to get the community involved in our growth process, and your growth process. We're all in this together and we are very excited. So thank you, Shoshana, for sponsoring the live tonight. And we're going to give more information about how you could also sponsor the live, and you can sponsor it in honor of whoever you want, or in memory of somebody, or just because you love Project Proactive. Here's Esther Goldstein, so we could start. But Sean and I will go live later on this week at some point to fill you in on more.
Hey, Rebecca.
Hi.
How are you?
Good. How are you?
Is my head chopped off? Because last time my head was like chopped off.
No, it looks good.
Okay, so you see my face.
Good. Yeah.
Okay, hi everyone. What were you just talking about?
I was telling everybody that we are now officially a nonprofit organization and that Shoshana is sponsoring tonight's live in honor of everybody like the Project Proactive community and in honor of that.
Okay, awesome.
Yeah. So we have a lot to talk about, so I think we should just jump right in.
Okay.
And you've been on our lives before, so I'm not sure if we're gonna we don't really have to do like a whole bio, but everyone could check out Esther Goldstein's website, integrativepsych.co, not .com.
.com. No.
Not .com. For her bio, and also you could check out her bio on the post about this live. So
yeah, and I guess I'm excited to be on here because I am a trauma and anxiety therapist. I'm excited to be on here because so many times people ask questions, sometimes professionally, but also personally. And I love when people ask me questions, and I'm excited to be on here because everyone has such important questions. And we're going to dive into some of them, but they're super valid questions.
Yeah, we got a lot of good ones, right?
Yeah, we've got a lot of good ones. Are we going to be answering questions that come up as well here? Are people asking on here or?
Mm-hmm. Yeah, I think so. I think we'll try to go through the ones that people sent in advance first, and then we'll kind of scroll back.
Okay.
Unless something pops up that's like related to what we're talking about.
Okay. Awesome. Great.
Okay, so let's start with the basics since we're talking about the basics. But kind of like, what's the difference between a therapist, a coach, a psychologist, blah, blah, blah. Like there's lots of different things, like it's a little confusing. So
yeah. So I think with the similarity between all of them, or at least the three that you mentioned, right? Like a therapist, a coach, under therapists, there's different kinds of therapists, right? There's social workers, there's mental health counselors, there's art therapists, right? There's trauma therapists. And then there's psychologists with a PhD, with a PsyD, there's psychiatrists, right? And then there's so many different kinds of coaches. But I would say all of them are there to be of help, right? So, and I think that every single one of them has a different job and they all have a really important purpose. It's just a matter of when you're looking for help or you're wanting support, I think the more clear you are on what kind of support you're needing, then the better chance you'll have the right fit when you're looking for that. So for example, like a coach, there's so many different kinds of coaches, right? Let's say a life coach. Um, Life coaches usually get training, right? They have like a year, 2-year training programs, sometimes 3-year training programs. The ones I know are usually a year long. And really they're about helping people unstuck in their lives. And the goal is really about like identifying stuck points and helping you move through to accomplishing certain goals. So it depends, like, do you want to become more organized? Are you looking to date? Are you looking to be better at your parenting, right? So there's a life coach, and then there's life coaches that specialize in an area, right? But the coach is more about looking at what's coming in your way and then helping you kind of create a structure and then implementing different behavioral changes and shifting your beliefs. The difference between like a coach and say a therapist is that therapists do usually dig a little deeper and maybe aren't as like, okay, goal, 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 in the same way, although sometimes they are similar. Because for example, so that's a coach, right? I'm just going to delineate the coach piece.
Well, sometimes therapists become coaches, right?
Exactly.
That's like
So
a new thing.
well, there's a coaching component to anything that's supportive, right? There's a coaching component to like, I'm going to be your biggest cheerleader and we're doing this really deep healing work. Or even if you're doing more of like a skills-based therapy where it is a matter of like, hey, we're going to track symptom reduction of like the amount of times that you have panic attacks or the amount of times that you get changed before you run out, or your level of sadness. So sometimes it is more of like a coaching framework, but it's therapy focused. But very simply, I just want to come back. So coaching is basically like there's certain credentials. You want to know what people's trainings are, right? What are their credentials? What are they trained to do, right? So if you're hiring a coach, what is she trained to do? I've had clients say like, why am I in therapy? Can my coach help me with this? And it's like, well, let's delineate, like, let's just get clear. Like, do you need a coach right now in your life? And if you went to a coach, would they be able to help you? Right. And sometimes actually people do need a coach and not a therapist. Or I've had clients plop in my office because they went to a coach and they weren't getting in anywhere and they needed like deeper work. And then they could use a coach after. Or sometimes you don't need a coach or you don't need a therapist, but it's really about knowing what it is that you need. So yeah, coaches are usually helping you unstuck. I think they are incredible. I think they've helped people be really successful, right? There's life coaches, there's business coaches, right? Um, there's fitness coaches, people. So there's kind of different kinds of coaches that help you and really are supportive. Right. So Esther Schwartz just wrote that sometimes therapists will practice under coaching because there's more leeway. So you're right. There isn't an ethical board. When it comes to coaching, it's a different board.
It's not regulated.
It's not regulated in the same way. And that's why you want to know when you're hiring someone, if somebody says, I'm a coach and I'm going to help you heal your anxiety, I'm a coach, I'm going to help you work through your relationship issues, you want to really get clear, like, wait 1 second, what's your certification? What's your licensing board? Is there a licensing board? Only just because if it's a sensitive issue, if it's not just about like something that's more simple, then it could get really tricky, and you want to make sure there's an ethical board and there's licensing requirements that are going to protect you, the client, right? If I was walking a client through some really complex emotional issues, then I've done a certain amount of hours. I have to get a certain amount of continuing education credits, be in supervision. So I have people on top of me. I have a certain board. If I do something unethical, right? All my clients know when they sign my paperwork, like there's information about if I do something that they think is unethical, here's the board's number here you can call. Right. So there's a licensing board and there's a structure to keep you safe. So with coaching, yeah, it's usually less. Coaches can be incredibly effective. I just want to say I know some coaches who have really helped people change their lives, but it's different. So if you're going to a therapist who calls himself a coach, you want to pause and get curious, like, are you working as a therapist or are you working as a coach? And then what's your role as a coach? And then what's your role as a therapist? Because my best bet would say is like, if you're going to a coach, go to just a coach. And if you're going to a therapist, just go to a therapist. And if they're blending the two, you want to ask them a lot of questions to tease out what job it is that they're doing to help you with.
So I had a conversation once with Blamey Heller, who's a parenting coach. What's her, I can't remember what her handle is. Do you remember Blamey Heller?
You mean her train? Like, she is a parenting coach?
No. I forget what her Instagram handle
is.
Look her up.
Somebody's got to help us out with parenting. I know Blamey Heller.
But anyways, yeah. if you want to see, like, she's a great parenting coach, you could look her up. But I one time had a conversation. We interviewed her once on our live and had a conversation, and I had a conversation with her afterwards. And she
unconditional parenting. Thank you.
So she was saying that that she actually does get people, yeah, unconditional parenting, that she does actually refer to a therapist if needed. Like she would kind of
she's wonderful.
know when
Yeah.
to refer out.
Yeah.
But also, like what I was talking to her about is a lot of the things that she does with her clients require a little bit of basic self-awareness and stuff that if you aren't at a certain place, that you might want to go to therapy to get yourself at a certain place to understand that better.
Right, right. Because Believe Me Yet Unconditional Parenting basically has really, really rich and really like robust knowledge about psychology and the way that we work and the underpinnings of our personality. So, right, it sounds, she's amazing at like the coaching piece. And right, so she'll give people skills. And like you're saying like basically sometimes people need to go to therapy just to get a basic framework and understanding of the way they tick. And then they could kind of go to parent coaching. Yeah, that makes sense.
Right.
Yeah.
I mean,
Yeah.
They might not even understand the premise of what she's talking about if they're not at a certain like emotionally healthy place.
Right. Or clear or knowledgeable. Right. So I think there's a point, right. So to answer the question, that's the coach and that's the therapy. I know somebody wrote something about like it could be dangerous. I do think it could be dangerous. I think I always say like being a consumer, right? What did it say? Somebody asked a question.
Oh, hands-on approaches, great points. We just spoke about this on our post, know thy source, know who you're getting help from, and then it can get tricky when dealing with individuals who may be endangering themselves or others. Yeah, so we were talking about that, that there are people who kind of misrepresent what they can do, and like what would be some ideas like to kind of like be wary of people who claim to do.
Well, I've heard like, hey, clients come to me or like people will call and say like, how long is it going to take you to help me heal my anxiety? My coach said she can help me in 1 session or she can help me in 3 sessions. And I'm like, I want to go to your coach. Actually, no, I don't, because I want to go to someone who's really going to help me. But wait, it doesn't mean a coach can't help you in 1 session. If you are disorganized and you're anxious because your closet's disorganized and this coach is going to help you work through the blockage of why you're disorganized, go to a coach. Do you know what I mean? But if you have like this hum of anxiety because it's related more to, I don't know, a certain like OCD behavior, like a certain obsessive thought in your head or a certain feeling of fear, constant fear. And so it may not be a coach that's going to help you with that because my sense is that like there's something deeper. So it might take a bit longer, like a couple of sessions or a couple of months, but a therapist would be more helpful with that. So I think it's
the coach might feed that.
A coach might say like, oh, so here's the danger, right? So a coach might say, hey, like, oh, you just have this like critical voice in your head. Or you just have this like, let me just go with, let's say, an obsessive thought of like fear. Like I'm in fear. And let's say my closet's disorganized, but if I start organizing it, like I feel really, really frightened, or like things are going to tumble out and I'm going to start remembering too many things, or I don't know, I just have this constant feeling of fear. So, right, a coach might take the approach. I don't want to speak negatively because some of the coaches I know like are actually really good at kind of like weeding out what is for them or what's for therapists. And I know somebody just wrote, if you have major problems of trauma, then a coach is not right or can make it worse. Exactly. So a coach who's not skilled, let's just talk about those, or thinks that they could practice beyond their skill level, might say, you know what, like I could help you. Like all you have to do is just work this through. Like I'm going to help you. I've helped so many clients. Like, oh, it's so normal to feel fearful, but like, don't worry, we're going to move through it. As opposed to saying, wait, can I hear a bit more? So you have this voice in your head, or you have this like this fear, and it kind of holds you back, and you've tried 15 different times to do something and you weren't successful. Like I might not be able to be the right fit, or we can try, but if this is not working after a few sessions, then I might want to refer out, right? So you want to be careful if you have a certain, it can be anything. It could be something that sounds more like an obsessive thought. It could be this insecurity, right? So we spoke about this last time where someone might say, going to help you work on your self-esteem. And then they have a coach who's really feeding them positive beliefs, and they can be really well-intended. But if the person has like a core belief that's negative, or a certain memory or a certain trauma or a certain experience that left them feeling really shattered and low about themselves, a coaching session is not going to help them, because they might not even might not even be aware of the fact that like their friend, their boyfriend, their ex-husband, their neighbor who was, very harmful to them, impacted them in this way. And it might just be unconscious, or they might not be trusting to a coach. And they're like, well, I'll just talk about everything else in my life. And they might just go spiraling in circles and still be feeling, let's say, low self-esteem, if we're talking about self-esteem, which is why as professionals, we must learn the techniques of other domains so we can always direct the client to appropriate professionals. Exactly. Whoever just wrote that. Amazing coaches are aware of what's within their domain. Amazing therapists as well, right? Like, I've had times where I'm like, I think you should go to a coach and not be in therapy, right? So I think for all of us, all professionals, whatever profession you're in, being aware, like, I'm not here to badmouth anyone because we all need each other. There's so many different roles. But as clients, I guess the protective part of me and Rebecca is when people are vulnerable and there's so many people who are sharing their services and we're so happy to hear about them. Just want to be really careful about what they could or can't do. Because at the end of the day, coaches are going to be more successful if they can help their clients. And it's better when it's within the realm that they're able to focus. So yeah, if there's a therapist, then the therapist should be operating under their license. Obviously, to work under their own license, they need to be, if it's a social worker, they need to be a licensed clinical social worker, not just the MSW or not just the LMSW. They need to be practicing under someone else then. If they're a LCSW, they could be practicing themselves, and still then you want your therapist to be getting supervision. And I'm a big believer of therapists being in their own therapy if they really want to be of help to you. And then there's, like, you were asking about different therapists or a psychologist, right? And then there's like LMHCs. So a MHC can't be practicing, right? It needs to be LMHC.
I think we'll put all of this into like one big blog post.
Okay. And then psychologists, right? Psychologists, the difference is psychologists, well, you know that, right? But like, it's different kinds of training. So they go for their doctorate, and then social workers or licensed mental health counselors go for their master's, and then it's a certain amount of hours they have to do, like 3,000 hours. Psychologists as well. And then the difference is just in licensure, right? You could put it in a blog. But it's really a matter of like the board that they're under. So that's very simple. And then, right, obviously therapists and psychologists are there to either do testing or, you know, clinical counseling, depending on what their skill sets are. Not every therapist is trained in the same way. Not every psychologist.
Right. So I was reading some things that there was a lot of myths that I found when I was doing I was looking up stuff on this topic,
right?
And people were saying that therapists diagnose and coaches coach, but like, I don't think all therapists diagnose. Am I wrong?
Okay, so here's the thing with diagnosis. So I think all therapists should be trained to know how to diagnose. It's meaning a client or psychologist does want to get like a really thorough assessment, and then they are creating a treatment plan, and the treatment plan is based on some kind of diagnosis, but it doesn't have to be like this like boxy diagnoses. But yes, there is a piece of you're diagnosing, or at least you're diagnosing a problem, and then you're kind of under that like diagnoses, then you're going to be defining like treatment goals, and then you're going to be targeting certain like symptoms that you want to shift or certain goals. So there is a clinical component of like assessing and diagnosing. It doesn't necessarily have to mean like that you're like slathering this like
that you're labeled.
Yeah, it doesn't mean that you're labeled, right? People are afraid, like, but right, you can go to a therapist and say, I just want to do insight-focused therapy, or I just want to process like a difficult dynamic with my mother-in-law, or I really want to work through this like blockage I'm having at work. And it doesn't have to be, the therapist does not need to diagnose you with like complex PTSD or an anxiety disorder, right? There are diagnoses that are called like adjustment disorders. Right, somebody wrote diagnoses are constructs to allow us for treatment, but should not be the focus of the process. Exactly. So the only time it's just kind of like a framework. So right, many people can get like an adjustment disorder. An adjustment disorder is a very PARV title, which basically just means you're navigating some kind of new change, a new work environment, you just had a baby, you got married, you moved, whatever, something small that you're adjusting to. And then you're addressing the adjustments that your mind, body, soul, spirit, or anything, right, behaviors are trying to make. So yeah, it's not necessarily, not every therapist is coming in with this like analytic lens and is like pulling you apart and then giving you a diagnosis. They could be supportive in helping you heal. It really depends on the kind of reason you're going to therapy and the kind of therapist you're seeing.
Right. I think that is also kind of what makes people afraid to go, because they're so afraid that like, oh, I'm going to go and like everybody's labeled with something, so I don't want to be part of that.
But I'm happy you're bringing that up because guess what? Like, it's true. Like, meaning I might feel more kosher if I'm feeling vulnerable or if I'm feeling like, uh-oh, I got stuff, right? Because we all have stuff. And do I feel safer going to a coach who's just going to be like, hey, you're a fellow human like me. We all have issues. Or will a therapist be like, um, like I think you're on the spectrum for OCD. You definitely have some flavors of trauma. You totally have you've totally had a depressive episode at some point in your life. Like I will feel pretty like discouraged or depressed, right? Okay, we'll look at the comments soon. But because Dr. Kostelitz wrote something great.
Yeah,
like, diagnoses, right? It gives us a framework of what we're treating exactly. And somebody else wrote, so I just want to finish this answer. But I think the thing is like, that's true. I just want to validate and acknowledge what you said because it's true. Like if I'm feeling vulnerable or if I'm feeling like I don't want to know this, I don't care if at some point I've had a depressive episode or I've had really bad anxiety or if I'm on some kind of spectrum, because yeah, we're all on a spectrum. And any therapist I see can tell me like, by the way, you have like these 5 different diagnoses, you know, or even one. I think it's a matter of like going to a therapist. That's back to the fit, right? Of like knowing who the right therapist is for you, where you can say like, I'm less interested in the diagnoses, but also choosing a therapist who has like a very human part of them, right? So who's able to see you as like just someone who wants to get better and is not necessarily sitting across of you and like going through a checklist and being like, these are the 3 different diagnoses. It doesn't matter. We're all on many spectrums, you know? And at the end of the day, it's a matter of like having a better quality of life, feeling normal and healthy and balanced. And normal is relative, but normal just means, I guess to me, being able to be in your skin, to be in your mind in a way that feels like you could engage with yourself and the people around you in a way that feels manageable. And even
if somebody thinks
of joy,
they're probably not normal.
Yeah, if people, I don't know who they are. But yeah, so I think that's the difference in terms of, right. So coaches could feel sometimes more relatable. I guess I'm hoping that there are a lot of therapists who are relatable, but that makes sense. I would just say like that makes sense why people would sometimes be kind of hesitant.
But yeah. Not all therapists would kind of slap on a diagnosis, right? No, I mean, I guess for psychiatrists, they would probably want to.
Psychiatrists will, because usually, well, unless you're just going for like an assessment to be like, am I normal or not normal? But which we're all normal, even if you have a diagnosis.
Or not normal.
Yeah, but even if you have, so I'm just going to say to anyone who does have a diagnosis or owns it, because most people can have something, you're normal, like just because you have a diagnosis, or if you're on medicine, or if you're not on medicine, like you're normal. We're all normal. I'm just saying, if we want to talk about like the neurobiology and how our brain functions, like just want to say that. Yeah, so therapists usually, many therapists don't go that route. Sometimes clients will say, so what's my diagnosis, like as a joke? And I might tell them like, hey, these are my thoughts. Or if someone has certain symptoms, I will tell them, hey, I think that you have some of these symptoms, and what that simply means is blah, blah, blah. And this is how we're going to help treat it. And we want to track these symptoms. But yeah, most of the time it isn't like, okay, my hypothesis for meeting you is that you have this diagnosis, boom. So yeah, there's many therapists out there that don't operate in that way. And I think a person who's hesitant has every single right to look for a therapist who's not, a label giver. And someone who has like a different kind of approach. So even if they have that framework, there's also a way of like working with you that's so human and relatable.
I just want you did read what
I did. I skipped the next comment.
But maybe we should just like read it straight through so that if we don't know what's wrong, how can we fix it? That's the purpose of a diagnosis. It's a roadmap to healing. Just
love that.
People don't see that after. And then hands-on approaches said, what I've wondered, because many clients of ours have used coaches, is do coaches have training to identify when their clients should be referred to a mental health professional?
Good question. I think it depends on the coaching program. I think that everybody's trained differently. From what I've heard and seen, I can't give names of coaching programs because I haven't done enough research to say, oh, these programs are great. These I'm really, really wary about. But I do know that some coaching programs are much, much more thorough and like, hey, these kinds of issues, you need to refer out. And other programs are not as thorough. So I think it really depends on the coach and the institute that they were trained by, which hopefully
but also,
they play into. Yeah.
People could just call themselves a coach.
I was about to say that because anyone could really say, I'm a coach. Like I can coach you to feel happy. I can coach your marriage to bliss. I can coach you to be an amazing parent. I'm being a little facetious here, but yeah, so people could just call
Right.
themselves a coach, and you want to check, like, are they just saying they're a coach because they're like a personal booster? Which we could all be coaches, but then there's no like operating force above them, right? Or I guess I'm referring to people who have actually gotten proper training and from some kind of organization, and then usually I think there's some kind of training. But that's the piece, like, just for a second, if we could go here for a second, like, that's also the piece of personal integrity and choice. Okay, like at the end of the day, there's therapists, right? Like, that's very nice. I was talking about having a license, right? um, all of us as therapists or non-therapists or whoever, whatever field that we're in, there's something about like knowing what I can or cannot do. There's knowing about when to get consultation. So somebody could be a therapist and be working. I know somebody asked about transference and countertransference, but we'll go through the order of the questions. I think it's about like being with someone who is wholesome and lives with integrity and knows the realms that they can be helpful to and is aware when they are above their head. You know, like, we could all get training. Everybody gets trainings about boundaries and, you know, like learn, like acting and being in line with what you're able to be of help to. But I think there's also about who's the person you're sitting across, who's the person you hired, who's the person you're consulting with. Like, do you trust them? And can you ask them about like what they can help you with? Because if they're not such an honest person, if they don't have very clear values or a high level of integrity, I'd be worried. I'd be equally worried for a therapist, a psychologist, a psychiatrist, a doctor, right? As a coach. Like, I'm not, I wouldn't call that a coach more than anyone else. I just think that you want to know people are being careful. What did she just post?
That's a bit scary for us to hear, considering that we're usually the ones recommending getting therapy when we discover abuse or trauma. We are OTs specializing with anxiety. Thanks for clarifying.
Yeah. Okay. So yes, I think it's a matter of two pieces. Number one, right, you really
But
want,
they don't have boards. Yeah.
they don't have boards. And I think that's the most concerning piece. So it's kind of like, but I do have to say my little pitch. I have met coaches who are amazing. The coaches who are amazing are the ones who are so thorough and so clear with their clients. And I think there are less than more. About like what they cannot do. They're like, this is not therapy. This is not this. This is not that. This is not this. Be clear. Read this. Assign to this agreement, and then I'm working with you, right? I think it's the coaches
this
who
is
are not
beyond
clear.
my purview. Like,
Yeah, and they're very clear. They're very clear. I think it's the ones who are not, or who maybe hope to be doing more or above and beyond, who end up doing damage. So
it makes me nervous when people say, like, I can heal you in such and such an amount of time, and you know, it's a guaranteed process that will work, and you know.
yeah, well, that's a danger. Anybody who makes those promises, that's concerning just anywhere for anyone, even the biggest expert for anything, because you don't know. You need to sit across someone, right? Like, I can help somebody heal through a certain trauma with, I don't know, like, let's say 10 or 20 EMDR sessions. Even though I know with EMDR marketing, there's been people have called and they're like, I heard between like 3 to 5 sessions. And I'm like, yeah, okay. That's like for a single incident trauma of like one time you saw a dog and it barked, and you don't have any other traumas, and you have nearly perfect parents. You never went through a change in your life, and you just are afraid of a dog barking. And then, yeah, that could be resolved in like 1 or 2 or 3 sessions, maybe. But when people say, hey, you help this person or that person, it's like, no, you're a whole new world, and you have a whole different set of symptoms, and you have a whole different way that you relate to people. And you know what I mean? So I think anyone who makes those promises off the bat is doing a disservice to people and also to themselves, because don't you want to be known as someone who's helpful? But yeah, anyone who makes promises like, I can heal your this in this amount of sessions, like, it's not true. You are healable, meaning I think we're all healable. Healable can mean that our symptoms are much less, that our quality of life is better. We have to define heal differently for different people. So, but yeah, I think there's a danger in doing that. And yeah, I guess coaches are getting the most slack in this conversation, not because coaches are bad, but just because it's become such a positive thing. What?
Because it's less regulated, but that doesn't mean that there aren't bad therapists who are damaging, and that there aren't.
It's just right. It's just that you could report a therapist. You could report a therapist. You could report a doctor. I'm saying I know people who have been really badly hurt by people who are doctors, rabbis, lawyers. I'm saying priests, right? Like, we're not saying that those are okay. We're just saying it's also like 2020. A lot of people call themselves a coach. They help people, you know, make these big transformations. But there's also people who sometimes are harmed. So I think it's important to know.
Also, like, Yeah, no, what I'm going to say is go off on a tangent, so I'm not
Okay,
going
so
to.
should we go on to the next question?
Yeah, but let me just read
Yeah.
hands-on approaches said coaches are great, but clients have to do good research
Yeah.
on who they're with. That's a very good point. And yeah, that's exactly what we were saying. And also, we're actually like working on a blog post for that will be on our website and Esther's website that will kind of like give a little bit more insight into all the different types of therapies and therapists, and just kind of breaking it down and more simple. So stay tuned for that. And then somebody else said, what if a therapist is referring you to a different therapist because she feels that the other therapist can help you more, but the client is not ready for the switch and comfortable with that?
I feel like saying, like, dear darling client, whoever you are, this sounds like a really, really sensitive issue. And it sounds like you're feeling maybe abandoned or whatever feelings you're having towards your therapist. I want to answer your question. It deserves so much more time and specifics, because I don't know why your therapist is referring you out. Is she really not able to be of help to you in the way that she wants to? Is it that you have a specific issue that's beyond her level of expertise and she thinks someone could help you? Is it that you're worried? I mean, maybe we could talk about transference or counter transference. Are you worried that you are too much, or is there a dynamic that came up between the two of you that's not resolved and you're afraid that you're just being shipped out to someone else? Because then it would be like, wait, I'm not ready. Could we first process through the dynamic that's happened between us? So I don't know the
Maybe
specifics.
let's talk about that, because that came up a few times already, the transference and counter transference.
So wait, I just want to answer this first. Okay, so wait, you want me to talk about transference, counter transference right now?
Yeah, just so that people know what you're talking about when you're saying
okay.
That'll help.
Okay, fine, awesome. But just to this person's question, I'm sorry this is so hard. I won't, maybe we could do a whole separate conversation about when your therapist, when there's changes, but it's really specific to your situation. So Rebecca, maybe she could write to you and then I'll respond briefly, but I'm not going to spend all the time on here because it really deserves a lot of attention. So transference and counter-transference, when I guess I'm talking about this person saying that her therapist is switching her over, which objectively could be a good thing. It could be a really hard emotional process. It could be done in a way that there's less damage and more gains overall, obviously. But I guess, so somebody asked about what counter-transference and transference is. So Freud actually came up with the terms transference and countertransference. So transference is basically when we project emotions, thoughts, feelings, experiences that we've had with someone, usually in our past, onto someone else. So say I'm looking at Rebecca and I suddenly feel like a really warm maternal feeling towards her because she reminds me of my grandmother, who was really loving and warm. So I'm transferring on all of these feelings that I've had towards Rebecca. You're nodding. Oh, of course I have warm feelings towards you. But basically, like, so I'm transferring over certain emotions, experiences onto Rebecca. That's a kind of transference. So I go to work in a new place and I have a boss and I suddenly feel like I don't like that boss because he reminds me of an ex-boyfriend who kind of had like an anger issue, right? So I'm just kind of like, just basically transferring all of those emotions that I had towards this ex-boyfriend onto this boss. And I suddenly am just like, ugh, right? But I'm just gonna, so that's transference. And now counter transference is basically usually what happens in therapy. They talk about counter transference as the therapist's response to a client's transference. So for example, say that I say I'm Rebecca's client and I come in and I'm having these really maternal transference feelings towards Rebecca. I'm like, oh, I love Rebecca. And I'm putting, because transference could be positive or negative, right? Positive is maternal. Like, I have these like warm feelings towards you. I have admiration. I think you're amazing. I think you're perfect. Okay. And so I'm starting to feel very like, oh my goodness, I want you to be like my mom. I want like to get so much love and hugs from you, whatever. Now, Rebecca, if you're the therapist, Rebecca, counter transference is you might have a reaction to my transference. So based on your own history, so you might have a reaction to my need for more nurture. So dependent on your experience, you might be like, oh, come here, sweetie. And you might break some boundaries and be like beyond overly loving, go over the time limit of therapy, overshare a little bit about your personal life because you're trying to be so nurturing to me. When essentially I need to do my own healing work if I'm feeling the need to have more a nurture in my life, then it's like we could notice that. It's actually important for me to notice, wow, I feel like you're my grandma. And then for you to notice, right, the therapist, that you're having this countertransference reaction of, oh my goodness, I just want to nurture her and I just want to take her home and snuggle her up. That would be your work to do in supervision, right?
Mm-hmm.
But that could be a dynamic that could be like the client comes in needing more and more and more, and the therapist is giving more and more and more, and it can end up being like actually harmful. And there's another countertransference reaction. Whoops. Okay. Another countertransference that can happen is, say, like I'm having all of these feelings, like these maternal feelings, and Rebecca might have a negative reaction to people who need a lot of warmth and love.
Uh-oh, you froze. Yeah.
Okay, am I there now?
Mm-hmm.
So say, like, Rebecca, you have kind of like an allergic reaction if someone in your life was very reactive to people. So you might be like, oh my goodness, what's happening right now? You can't feel this way. Oh my goodness, no, this is a therapy relationship, and you might come like really harsh on me. And that would also be like a negative countertransference, right? So countertransference, so that's if you're not managing your own countertransference reaction, right? So when therapists come down almost like boundaryless, that's how you'll usually see it, or no boundaries, or like intense boundaries in a very cold way, kind of like, I'm the therapist, you're the client, what's going on here, right? So transference, back to that. So it's basically like having, like putting onto someone else something that belongs to a different relationship or someone else. And then countertransference is usually the therapist's response to that. It could be more subtle. It could be something like, I might come in, I'm just going to use you as a therapist, I mean, as a client. I might come in and be really angry because I came in and I don't know, somebody outside or something that you said really made me angry. And I am bringing my anger and my aggression and my rage into the room. And I'm just like, what's going on here? And so that's me transferring over. Let's say I'm like really mad because I'm finding you, whatever, being like someone in my life, or somebody outside is bringing up my rage. And then a bride, no, I didn't answer your question yet. We're going to answer it very soon. And then if I bring it in, Rebecca, to you, and then your job is to work with my transference, my rage, right? But you might have a countertransference reaction, and you might start being you might almost act to me as if like you're a parent, and you become very controlling or demeaning or kind of very withholding, instead of like, wow, let's just notice what's happening right now. You have a lot of rage here, right? In a very compassionate way. So what's happening is that it gets messy. There's therapists who talk about, like Carl Jung speaks about how it can be really harmful, but essentially it could also be helpful. Transference, like I tell clients all the time in the beginning, I think I spoke about this, like if you're going to work with me, you're going to get, I'm letting you know right now, like there's going to be times where you might get really mad at me. You might get upset. You might feel misunderstood. I'm probably going to make mistakes because I'm human. Please bring it up. Like, I want to hear about your rage. I want to hear about your anger. Like, I think there needs to be a safety in that. A, the safety for the client to bring it up. B, also the safety in trusting, even if a therapist has a reaction, because we all do, that the therapist is A, going to regulate themselves, right? And number two, be in their own therapy and or supervision to be able to really process, so that like it comes back to the client to help them work through things. Transference could also mean like, it could be even in like daily interactions, not just in therapy. Like say you're in a relationship with someone and you start thinking that, like, let's say you think your husband is mistrustful or lying to you, and you're just it's because in the past you had a relationship where someone cheated on you, so you're transferring onto him the fact that he's a mistrustful person when really he might not be at all. Okay,
So if the therapist would obviously need to be on top of their own therapy in order to manage their counter transference, right?
yes, because there's always transference happening. There's positive transference or negative transference. Like, I adore you, you're amazing, you're perfect, I want you to be, like a maternal transference, right? There could be like, I want you to be like my mom, or paternal transference, or there could be like erotic transference where people have sexual feelings towards their therapist. And therapists need to be skilled and okay with and expect these things to come up because they come up. And then there's also negative transference of like rage, aggression, anger, like many different emotions, disgust, and those are expected. It's not like, oh my goodness, what's happening? It's, yeah, so therapists need to be aware of like all the kinds of transference that are going to come up for clients, because they're allowed to, and they need to come up, obviously within bounds that are safe for the therapist, and to be aware of their countertransference, because they're going to have a reaction. And the more the therapist has done their own healing work and the proper supervision and training they have, I'm going to answer Bride's question. The better they're able to be able to like catch it and then obviously stay within the realm of being compassionate, but still boundaries. They are not allowed to be sexual with our therapists, Bride. We were just answering the fact that there's something called erotic transference, which is when a client might feel sexual feelings towards a therapist, and how that is something that can be processed through. So no, sexual boundaries are never, ever, 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 ever ethically or legally or anythingly allowed. But good question.
But probably for a coach, since it's not regulated, it might not be so much of a problem.
You're being naughty, Rebecca. You're being naughty.
I like coaches. I said nice things about coaches. I'm a coach.
So fine.
I'm not a coach.
Anyone? Oh, Rebecca, the coach. Rebecca, are you? Look,
I'm not a coach.
Anybody who's not working, right. Very interesting, and it's reflected in Hollywood films. I know. You know what? Some of these Hollywood films, like, they have to put in something exciting or something sexual because they want people to watch. But they give some people a really, really bad rap. Although there's some really great movies, right? Lawyers too, who have amazing therapists. Who I'm like, oh my god, I want to go see her.
Yeah, on Suits, I think there was a few lawyer therapist relationships.
Oh, lovely. Okay, so let's go back to.
Should we go
just about transference, countertransference? Oh, okay. If you notice you have transference feelings towards your therapist, and you trust your therapist, please bring it up. Or if you notice that you're having transference in your relationship, you're not in therapy, right? But you're thinking that, your husband is being disloyal, or you're feeling like your friend is talking behind your back. You want to check on it, not like coming across attacking. You want to check, are you transferring onto someone an experience you've had with someone in the past, or is it something real? I just want to differentiate transference and projection. Projection is something different. Projection is like somebody starts working at my workplace and I'm not sure if I like them, and then I project my feelings of not liking this person onto them, and I start saying like, hey, Charlie doesn't like me. I want to show you how Charlie doesn't like me. So I'm projecting my feelings onto the other person, and I start thinking they have those feelings towards me. That's different than transference. Transference is like I'm putting certain feelings about someone, usually from my past, onto someone. Okay. People are asking really good questions. Do you want to go through the questions earlier, and then we'll look at the list of questions we have?
You know what? We can always do like follow up with extra questions and follow up posts. So we might as well just do the ones that are on the live first, and then we'll just add.
Okay, but the thing is that I did promise somebody to answer a question.
Oh, okay.
Answer her question first, and then we'll answer the ones that are on the live.
Oh, okay. So the wig stylist just asked one that's actually on our list.
Okay, so let's go with that then.
Okay, fine. So how do you know if you need a therapist versus a friend and family member who you can speak to about your problems?
Okay, so thank you, the wig stylist. I'm sure you're a great wig stylist. Good question, right? I think that, right, people sometimes say like, wait, are you just like my friend? I could talk to my friends about this. If you have amazing friends, if you have friends, family that are able to be there to support you with something that you're struggling with, or you just need support with, because like, hello, we're all humans, we all need support, that's great. I think the times where we need a therapist is, number one, if it's something that really is private, and if you start sharing this information, it is going to jeopardize something in your life. So kind of if you're having a disagreement with your husband, or if there's a specific issue that your child is struggling with and it's really, really private, and to protect yourself or the person in your life's ability to function and show up and everything like that, then you might want to be more sensitive and speak to someone where like your privacy is like bulletproof, right?
That's
like,
a really good point.
Talking about boards. Yeah, well, there's times where it's kind of like there's a specific issue, I could talk about it, but my husband's going to actually not be okay with that, or my child's going to feel a lot of shame, and it might impact him socially, or it's going to impact his trust relationship with me or my best friend or whatever, right? So I want someone who I know ethically and legally really can't repeat this, and they are probably going to give me good insight. So that would be the first thing, confidential. Honestly, that's where I would go to. Exactly. Someone just wrote, you need supportive people while you go to therapy. For sure you need supportive people.
Therapy's hard. It's not easy.
You also need supportive people, period, because therapy could be a way to help you get supportive people in your life. But okay, wait. So the second piece is if you have a specific issue. So like we were saying earlier, like if you're having like anxiety or insecurities or things like that, and your family or friends or whoever it is, or a rabbi or mentor or priest or whoever it is that you're consulting with could be helpful to you, and like the regular pick me up of like, hey hon, you're awesome, you rock, like I got you got this. And sometimes friends who are even like a little bit more insightful, right? can be of help, then that's great. But it's kind of when something's bothering you or the regular advice from even your smart friends is not helping you, then you want to go speak to someone who has specialized training, skills, or knowledge in it. So, for
Also,
example,
sometimes
yeah.
like if you're going through something like big, it could be like a strain on if you're relying on a friend about something.
Yes, or if you're friends, or if you're starting to, right. Good question, right? It's kind of like when it's like kind of like when you're starting to lose your friendships, meaning when you're making your friends into your therapist, or you're making your husband into your therapist. That's another amazing reason to go to a therapist, because you need your friends to stay your friends. When you start becoming that friend where like, oh no, she's needing me, right? Or oh no, right? So then it's like, uh-oh. Like I for sure was that person. I remember years ago, I would go through my list of like all my sisters and then different friends. And I remember at one point I was like, guys, I'm not calling you and I'm just calling to ask you like, hey, can we meet up for coffee? But I remember that feeling, and it's like, wow, like friends just need to be friends and family just need to be family. And it's beautiful when you allow those people to be there and you have exactly what you need from a therapist or from like the right kind of person supporting you process that. Because at the end of the day, they're not good at being your therapist. They can't help you. They just want to be your friend, and they're actually not trained or meant to be anything more than that. You're lucky if you have therapist friends, but even then, therapist friends are not as good as your own therapist, because.
But also, when you have a good therapist, you end up being able to be your own therapist at a certain point, and you rely less on your friends, I think, like for that type of support.
Well, you kind of develop your own inner wisdom, right? So it's kind of like, I'm actually not going to ask this friend for advice because I kind of had to have a better answer for what's pertinent to my life than what this friend would tell me, because she would give me a good answer that's good for her or based on her experience. And I'm becoming pretty expert at my life, or right. So you're kind of, so
and I could say like, what would Esther Goldstein say in this situation? And like, rather than that.
Yeah, well, one of the things that happens with a good therapist is that you develop their voice in your head, and you use that as kind of like the wise voice blended with your own voice, and it's actually helpful. Okay, so that's what I would say.
Reporter said people talk freely with the people they meet in airports because of the built-in confidentiality.
I hear that. They better not be coming to your town. Our hairdressers. Okay, what's the next question?
Somebody said a therapist is not a friend.
A therapist is not a friend. No, a therapist is not a friend. If your therapist becomes your friend, then you have lost your therapeutic relationship, and that's really upsetting. The way that I look at being a therapist is like, I have specific clients that I see who are so important to me. I've done lots and lots of trainings, will continue to do trainings. I get consultation. I'm in my own therapy, so I can continue to give them really good work. If I make those people my friends don't get that same level of attention. It's a different kind of relationship. Like I might see them, but like, if I'm not available for some time, like, no, I'm not here. I'm not paying exquisite attention to every single detail of what's going on. I am, because I'm a friend, but not in the same way as like I'm your therapist, and I want to understand the complexity and the dynamics, and helping you heal. So it's very different. And no, your therapist is not supposed to be your friend. You could be friendly with your therapist. You could feel like, wow, like there's a friendly, warm dynamic. But the boundaries and the kind of the agreement that you have, and right, like the board that kind of protects you, helps protect the relationship, that it's a therapeutic relationship. You have like a contract. Okay.
Like you could say, if we didn't have this type of relationship, we would probably be friends, but it doesn't really.
Sometimes you hear that a lot, Yeah. Like, oh, I would totally be this person's friend.
We used to say about, I have an osteopath, and like a few of my friends go to the same one, and we used to say like, oh, I wish that we didn't go to her as an osteopath, because like I would love to go out for coffee with her. And
right, it's like, can I make a clone of you, and one of you is going to be my therapist and one of you is going to be my friend, because I would totally love both of you.
I know. Okay, so let's look at, so how do you know when you need therapy?
Well, we kind of just answered that question.
Yeah, we kind of did.
Should we go with the next one of how do you know when you've graduated therapy?
Yeah.
Okay. Okay. And then the next one after this is the question that we're going to answer. Rebecca is going to be the question that someone asked about how do you know when going to therapy is better to go to a religious therapist, or is it okay to go to a non-religious therapist? That's going to be the next question after, okay?
Or somebody in whatever spiritual the
Right.
religious
Culture.
culture
Right.
you're in. Yeah.
Beliefs. Right. Right. We'll talk about that more broadly. Okay. So we're going to go with, how do you know when you graduated therapy? So very simply, we said earlier about diagnosing or treatment goals. When you are reaching your treatment goals. So for example, if you came into therapy and your goals might have been like, let me just talk about, I want to resolve like a certain issue I'm having with a friend or with a family, or I'm struggling with a certain child. And you're really making headway, and you're noticing that that issue is a lot less stressful. You have much, much better skills at dealing with it. You've come a far way compared to when you came in. So kind of that issue is more or less resolved, or you have more skills in dealing with that issue, and you're starting to notice that your relationship to that specific issue has changed, then you have successfully more or less reached that goal. Now, sometimes what happens is that, like, okay, so maybe you're amazing at setting boundaries, or maybe you're really good at not having chaotic relationships. And so you might say, hey, that's awesome. So I graduated this goal. Now you get to make a choice, because you're the person in therapy. You could do it with your therapist. Do you want to end therapy at this point in time? Or did you notice there's a bigger theme, right? It might be like a theme of like worthiness, or the kind of way that you even interact with people, about getting too close too quickly and then not having any friends, and that's when you have chaos. So is there a deeper issue of like, how do I connect to people and relate to people, or my sense of belonging? That's come up. So kind of, even though we like put away a certain issue, do I want to graduate and say, let me see how it feels to be in my life right now? Or do you want to move on to a different like target, so to speak? So graduating therapy it's a really personal decision. I mean, there's clients that I've graduated when like more or less they feel really skilled and they feel really capable and confident in dealing with things in their life. Sometimes different phases of life bring people back into therapy, but like, people graduate. So I would say like that you reached the goals that you wanted, or at least you might say you wanted to work on your anxiety, and so you still have some anxiety, but like your quality of life is so much better, and you kind of feel like you could do it on your own, or like you reached a certain goal. But I always say you have to be fluid with how you see goals, so yeah, that's how you know you graduated therapy. But this should be an ongoing conversation between you and your therapist. Like, I think it's important to check in with clients, like, how's it going? I know we started up with these goals. How's that going? Let's just check in if we're working on the things that we said that we're going to work on. Sometimes it takes a different goal, and then you want to just like reframe the goals and make sure that you're moving on track.
But have you ever had when the client says, I think I need to graduate now, and you don't think that they're ready, but
yes, absolutely. Absolutely. Even though I tend to lean to the side of kicking clients out prematurely, and that's been my own work in supervision of like, wait, like like, because my goal is really to help people feel much, much better for a very, 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 very long time. So I've slowed down on that. But has it happened? It's definitely, I guess you're asking me, it's definitely happened. I've had clients where, let me just toss up in my brain, going back many, many years. So yeah, I've had a client who said, I've had a client who said, like, I really want to be done with therapy. So it wasn't like I want to be great. It wasn't like I'm done, meaning usually when a client's starting to graduate, it's a conversation where like we're noticing a huge shift. I'm noticing like, you don't need me anymore. You've made better friendships. You have more support, your life, whatever it is. So it's kind of like an ongoing conversation. And we're like, hey, we're working towards kind of dropping down or helping you leave. The kind of question you're talking about is a different one. When a client might come in and say, like, I really want to be done with therapy. I just want to be done. I just want to be done.
Like, maybe it's like an added stress in their life that like they feel like, there's so much going on and I can't handle therapy. And
yeah, okay, so right. So the time that's come up when a client comes in kind of like where it isn't like, oh wow, they're ready, or at least it's been something that we're seeing. It usually is like something, right, exactly like that. Something in their schedule changed and they really cannot engage in therapy. And then it's time for you to kind of, you could call it graduating, or say take a pause, or just say like, let's kind of find a way to wrap up and say like you're graduating with the work that you've done already right now. Sometimes it's like
AMA.
Sometimes it's like, right, sometimes it could be something else that's going on. Like if it's a financial thing, then it's kind of like you want to make sure that therapy is successful and that it's possible for the person to be engaging in it, because it should never cause too much of a strain in a crazy way, right? Or in an unmanageable way. I guess the thought that I went to was when a client might say, like, I want to be done with therapy, is when usually a bigger issue is coming up, or there's something that's more complex and they just don't want to be doing the work because they're frightened they're never going to get better, but you're actually at the cusp of doing a really deep piece of work and healing, and like a part of them is getting uncomfortable or frightened. So that's where
So that would make a lot of sense.
Yeah, exactly. That makes a lot of sense. So sometimes I'm like, it makes sense that you're scared. It just clinically, it feels like we're actually about to do some really, good work. And then obviously it's a different conversation. So you never force a client to be in there. It's always like, you can make that choice. We have done amazing work. What can we do to help you feel more okay with continuing? Or at least giving it 1 or 2 more sessions, and then we can reassess. But yeah, you have a right to graduate at any time. Like, there's times where scheduling or finances or emotionally you don't have the energy, and you have a right to say, like, I'm good for wrapping up now. Like, you never have to continue. There are times though.
It really is hard work. So if you, I can imagine that if somebody, like sometimes, like let's say somebody has a medical diagnosis where, and until their medication is in check, the therapy is just like too much. Right? Like I've seen that.
Sometimes they need to be on medicine before they start therapy.
Right. So
actually do therapy.
Right. So like maybe it's just too much until things are more stable, or I don't know.
Yeah, so that's a good question. So kind of, well, that's not so much the graduated therapy question. That's more of like there are times where people will call and I'll say, like, you do not need to be in therapy now. Like, you first need to get on medicine, or you first want to organize your life, because you're not going to get the most out of therapy. And I want you to, if you're going to be in therapy.
Are there certain stages of life that are more conducive?
No. I'll tell you why. Because look, every single situation, and then we're going to go to that question about like what kind of therapist, culturally, religiously. The reason I'm saying no, Rebecca, is because, oh my goodness, because at every different phase of life, there's a different reason. I would say yes, honestly. The best phase of life, but we don't always have the luxury, is to be in therapy where you have like supports in your life. You have at least some kind of financial support, or you have some kind of emotional support. Because sometimes people will come in their lives were chaos or traumatic or difficult or anxiety provoking, and finally their lives settle down. And then all of their anxiety or trauma or fears start bubbling up because I finally reached a stable life, and oh no, my symptoms are coming up. I see that a lot.
Oh, that's like when you get sick when it's vacation time, right?
Yeah, it's like when my body is like now. But Rebecca, the only reason I said no was because many people don't have that luxury, and it's like, I need to heal when I don't have all those supports. And to those people, I would say, like, you can still do it. Like, you can still do it, and you are going to get towards those goals then while you're doing this hard work. So that's why I'm saying that. Because I've seen people say, like, I wish I did this earlier, or I wish I knew I could pace the work slower, or,
So you're saying it's never too late?
Never too,
and
it's
whenever
never too late for
you're
anything.
ready.
And it's never too early. No, I think you have to be ready, and then that's your timeline. But if you're ready, I don't think that you should push it off, especially if, like, you're suffering. You can get better. You can get the right support.
Mm-hmm.
Okay, could we go with the question where somebody asked?
So Firm Reporter just had something along that line to say. People who are looking for religious sensitivities from therapists should try regular therapy and give it a chance and see if it was so different. Looking for a from therapist can risk the focus.
So can we go with the question and our answer, and then we'll kind of bring that up? Okay. Okay. Also, Rebecca, it's almost 10 o'clock, and I thought we didn't even have enough content to talk about. Okay, we're going with this question. When going to therapy, is better to go to a from therapist, or is it okay to go to a non-from therapist? So I am going to break this a little broader, and I'm going to ask the question of kind of, if you're from a certain like religious group, you're from a certain cultural group, a certain ethnic group, a certain community, then is it best to go to somebody who comes from that community, or has that same kind of school of thought or belief system and values, or is it okay to go to somebody else? Now, I split this into 2 separate questions, and one of them was like, if you're going to therapy, and one of the core issues and some of the biggest questions that you're addressing is your spiritual beliefs, your values, or something that has a very deeply rooted spiritual basis. So for example, right, if you have certain laws of like respecting your parents, and you want to speak to someone because your parents were or are emotionally abusive or abusive in some kind of way or neglectful. And we're just going to go Jewish for a minute, right? So, and there's like technically a Jewish law of respecting your parents, then then you might feel more comfortable going to a therapist who has knowledge and experience and understands like the religious laws and also the emotional understanding to help guide you with this. Because you might have that worry of like, wait, you're just going to tell me emotionally to set a line, but am I going to be overriding some of my my values or beliefs?
By the way,
Now,
Esther Schwartz has a YouTube video on. You can find it on our YouTube channel in I think the Jewish community section, where she talks about that with Rabbi Shais Taub, that topic specifically.
perfect. And just a little snippet, I imagine that Rabbi Taub is going to give you a wonderful halachic, right, which is like the Jewish law and emotional answer. And just so you know, anytime where something is very, very, very damaging for you, Jewish law, right, and we're just going to speak Jewish law for a minute, really goes towards your health because you need to protect your health. But let me just say this for a minute. So if you have like, if you're at a point, let's say if you're looking for a specific guidance on that, my sense is that I like separating the two because I think ideally you need to have like a rabbi or someone who's giving you like the laws and the values, and then to have a therapist. Now, if you are specifically looking for two in one, then I would say I can understand why you're looking for someone who has that religious understanding and a robust understanding. Now, that does not mean that they're suddenly your rabbi, but that means that they have hopefully a rabbi that they consult with about these specific sensitive issues specific to your situation, because it's a case by case basis, and they're understanding the emotional implications and supporting you on that, and also like the values, your spirituality, and your beliefs right there. Mm-hmm. So I think that's where I can understand why you might want someone who has similar values and has a similar understanding to you. I do want to say also sometimes when people are at formative years, like if you have a child who's a child or a teenager, or you're at the phase of really defining your beliefs because you're not quite sure what your beliefs are, then you might want to be specific on the person who you're choosing, that they be very similarly in line with some of the beliefs you have, or someone who could be a role model for you, because you really are going to be impacted not just emotionally, but also really on their beliefs. And I can appreciate that very much. So I think that's where it's important to look at, like, are you looking for them to be more than a therapist? But because all therapists take more of a role, like they're a role model in some way. But are you at a phase where, number one, you're really impressionable, and number two, your issues are very specifically, deeply, seeped in something that's very much related to your belief system?
Like when 2 weeks ago when we were talking to Yankee Greenberger, and he was talking about moral incongruence and like sexual types of addictions. So it was very helpful specifically for that topic to have somebody that knows both, although it's not exclusive to the Jewish community or to the Catholic community, because what we realized when we were when we were doing research for that live is that most faith-based communities struggle with similar issues.
Yes, right. And the shame, and then what we talk about or what we don't talk about, and then what people are struggling privately with, right? So, but here's the thing though. So that's the thing. So it's kind of like if you're at a phase where you're impacted by the person and you're kind of like really moldable and you're going to be impacted by them, or the issues are very specific to your belief system. So that's like one thing. And the second piece that I was thinking about is like relatability and understanding. So is this really about like, I want them to have similar beliefs because I'm taking, they're really going to be a big part of who I am becoming. And because I really want them to understand like the faith that I have. Or is it more about like the relatability aspect? And I don't think that there's a right or a wrong. And I'm going to say this even like as an Orthodox therapist, I will consult with a rabbi, even though I have heard many different answers for many different clients, or I will speak with somebody if, let's say, they're part of a certain church or they're part of whatever it is of their background. I'll ask and say, who are these people? Let me hear more about the beliefs that are really important to you. Because it's important for me that I am understanding what your beliefs are and I'm being respectful of that. But I also always check, I'm just going to Jewish because we're on Project Proactive, I would check with the rabbi as well. So I wouldn't just say, oh, just because someone is from or somebody's religious or part of a certain ethnic group or cultural group, that like you're good to go. I think that you need to be like, A, are you good clinically skilled? And B, Do you understand? Exactly. An expert from outside of the community who's willing to engage in cultural consults. Exactly. So you want to have like cultural consults. So even if I was from a complete, like I have people who come to me from different backgrounds or different ethnicities, it's important that they know as well, like I am going to get consult to make sure that I'm going to be culturally appropriate for you and the specifics of your situation, right? That's part of consultation, but also specific for a situation. I know of a colleague who was working with someone from a certain part of the world, and I can't go into details, but and they had a very specific like code and the way that they engaged and certain things that they would recommend for most clients would have been completely wrong for this person. And so this colleague got like specific consult, and it was very wise and did very, very good work. But I think it's important, exactly what Dr. Koslowitz is saying, that being able, exactly, right, getting cultural consult. So A, number one, knowing the person's a good professional, and B, getting consult. So you're asking about religious or part of a certain norm. So I would say, like, if you get that package of 2-in-1 and the person fully gets you and they also are consulting, because even if they're part of your community, I think it's important that they consult specific to you. I think that it's a very personal question. But the second piece is relatability and understanding. You absolutely need somebody who relates to you and understands you. So if you feel more comfortable going to someone who relates, then that's a personal preference. Is it possible that you might go to someone who relates but isn't helpful to you? It's possible. And then you might have to make a different choice. Like, I know from my own personal experience, there was a time where I chose someone when I was younger who like really was more of like a mentor figure, and like a lot of like our spiritual beliefs were in line or things like that. And then at a certain point I consulted with someone who has very different beliefs, but I was a very whole, solid person. But I wanted a certain area of expertise, and I'm also a little picky because I'm a therapist. And it's like, I want a specific level of experience, and I don't specifically need somebody from a certain community. But I think it's a personal preference. I do think they need to have relatability and understanding. And I think that they need to respect and understand your beliefs. But I think it's okay for you to say, I want,
you don't want somebody who's going to look at you like there's something wrong with you because of your beliefs, which hopefully most therapists would not be like that.
I actually heard recently, somebody told me how she went to a therapist who has a slightly different kind of belief system than her, and she made like a sweeping projection and made some judgment on like, oh, but you're this, and it was terrible. It's like, what? She didn't actually even ask you about your beliefs or about how that impacts you, and if that is important to you, like that's so right. Meaning, like, I think it's important to have obviously a healthy, balanced therapist. Part of that is also, by the way, countertransference. Countertransference is like, say your therapist, I'm just going to go extreme for a second, okay? But like, say you start talking about an issue you have with your child, and it's bringing up with the therapist an issue that the therapist is having with her own child or his own child, and the therapist starts having a reaction, or you start saying your opinion about a certain minority group, right, or a certain sexual orientation group, and your therapist is part of that sexual orientation group or has like a family member that's related to that, and they start having a reaction to you. That's also, it's the same thing. All of this goes into it. So like religious beliefs, sexual beliefs, all of that, like the therapist needs to track their own reactions, right? If a client comes in and says, this is my belief of God, or this is my belief of how I need to be, you want to be with a really healthy therapist that's tracking their own reactions and isn't just like, oh, you're part of that group? Who do they think they are, right? Or, right? So it's kind of, and the therapist needs to regulate themselves to be like, I'm really just objectively hearing my client and I want to hear more. And if I'm having a reaction, I'm going to process that, obviously my own supervision, but this is my client. So I think it comes with religious questions as well. I know I didn't give you a black and white answer to the religious question, but the reason I'm not doing so is because I've heard clients who've gone to people who are, you know, part of their same cultural group and were very badly skilled and they did harm. And then they went to someone who was outside but got good cultural counsel, like Dr. Koslowitz is saying, and they were so relieved. And then there's people who like spoke to people outside of their group and they really needed somebody in kind of who understood their, you know, cultural norms, and that was helpful. So I think it's really case by case basis. I think as a parent though, or as a partner or whatever, you have a right to say, you know, I want to be careful about who I am going to, who I'm sending my child to. I think you have every right to say like, this is going to impact them in some kind of way.
If somebody is trying to find a therapist that would be in line with them, like would they would, you know, come up with a list of questions and
I think, yes, I think clients have a right to say, like, I've had clients ask me really interesting questions. I think they have a right to ask questions either from other people or the therapist themselves. Yeah, like, and you have a right to say, like, I hope this is okay with me asking you this. But I'm at a point in my life where I'm really looking for someone who has certain beliefs. I know somebody called me and said that somehow my information was on like a Christian counseling list, and I don't know how it got there. And they said, are you something about Jesus or Christian? And I said, no, I actually want to let you know that I'm Jewish. Obviously, I operate from a very spiritual and meaning focused place, but they were like really thankful that I was like transparent with them. And they were like, no, it's really important that I see someone of my faith. And I said 100%, and I helped them find someone. So I think it's okay to say, like, to ask some of these questions.
so
Exactly.
if somebody's searching
Yeah.
so if somebody's searching for the right therapist, so like I know you do like 15-minute consultations.
Yeah.
Like if somebody it is the purpose for you to kind of interview each other and make sure that you're the right fit?
Yeah, exactly. So 15-minute consults that I give clients, I'm just looking at the questions. We're going to have to go through some of them. So, yeah, 15-minute consult is really me getting a sense of them to see if I can actually be of help to them, because there's some issues or certain specifics where clients mention, and I'm like, I don't think I'm the best fit, but I have some really awesome referrals that I can give. And also for the client to get a sense of me, like, are they comfortable with me? People have asked me lots of questions. Someone asked me recently about, she's like, trauma therapists usually, I would think that they're much, much older, like in their 50s or 60s. So complimented that I look young. But I'm older than I look. But she kind of said, like, she was asking me those questions, and I was like, I'm happy you're asking me right now. Like, you need to feel comfortable with who you're seeing. Or someone wanted to know about my expertise and some of my skills, or like the boards that I'm under, or supervision. Like, ask away. Some of my spiritual beliefs, or that I wouldn't go as much into detail, but a person has a right to kind of ask some questions. But I think as a client, you can always ask, and the person could always say, I can't answer, or this is my answer, and then you get to decide what to do with it.
That's important. So you just brought up another. You reminded me of another question. So what does it mean to be trauma informed?
Okay, exactly. So trauma informed means, like, very simply, right? Like, you have information about trauma. There are many therapists out there that are trauma informed that do not do trauma therapy, do not do good trauma treatment. Trauma informed just means I know a lot about trauma. Now there's many therapists who do amazing trauma work, and they call themselves a trauma informed therapist. And I'm not telling you that they can't do good trauma therapy. But when people say I know about trauma therapy, there's a big difference between knowing about trauma and knowing about trauma therapy to knowing how to heal trauma and how to actually implement and engage with and take a client through the trauma healing journey. So first of all, any therapist is going to know about trauma, hopefully, because they are human and we all go through trauma, big or little trauma, or they see it, right? Anxiety, depression, mood issues, relationship issues, all of that is under the umbrella of trauma. Now, you might be like, yeah, I know about it. I've treated it. It doesn't mean that you're actually good at treating the specifics of trauma. I know, like, the trainings I've done, my post-grad trainings, like, they were trauma. I had to first become a trauma therapist before I then became, like, skilled in specific issues, which means trauma therapy training is that you learn a completely different approach in the way that you understand the human mind, body, psyche, and spirit, and understanding how experiences, relationships, dynamics impact us, how they impact our minds, how they impact our bodies, so you're understanding, like, the human being completely differently than just like regular therapy school. And if somebody is just like an EMDR therapist or just a somatic therapist, like, that alone in itself does not make them a trauma therapist. You need to be
So that's trauma informed.
It's trauma informed. So those are trauma informed. Those are trauma methods. But like I always say, I don't think EMDR therapy alone can heal trauma, because you need to be a trauma therapist who then uses EMDR therapy. Because basic level 1 or level 2 EMDR therapy, without getting fully certified or getting advanced skills in EMDR therapy, you are not going to be able to help clients who have trauma, because there's so many complexities that are going to come up in the trauma work, in the EMDR work, that plain EMDR therapy, the basic training of like how to work through a trauma, is not going to be helpful. So if you've seen someone who said they're trauma informed, you want to understand, like, what does that mean that you're trauma informed? Do you have a specific skill that's a trauma therapy skill? Are you a trauma therapist? Do you get specific consultations specific to trauma? What does trauma mean? Do you work
Well,
with
trauma informed seems to be like all over the place now. Like there's trauma informed daycares and schools, and so
that could be a good thing. That's what I'm saying. It could be a positive thing. Trauma informed could mean that like they understand not to yell at kids, or they speak in a, or like I know a lot of schools have like this transition time when they're going like from one activity to the other, and they'll engage in like a great somatic exercise where
oh, that's a good idea.
yeah, they have the kids like push against the wall, so they're kind of releasing some of like the body energy. So this, I'm just saying, like, I think it's a good term. You just want to clarify what that term means. Because if I call myself trauma informed, right, what does that actually mean? There's lots of therapists who call themselves trauma informed, and they might be trauma informed. And back to the coaching thing, right? They might say, like, I'm great at helping you if you have certain kinds of trauma, but this other kind of trauma, I can't help you. Just like a coach might say, I can help you with this, but I can't help you with that. And there's a very big difference between that, like to people who are like, I'm trauma informed and I can help you work with like complex trauma, or if you have a dissociation that happens, or you start spiraling or having flashbacks or having emotional flashbacks or panic or anxiety, or I don't know, or are unable to be present doing the trauma work, and they don't help you with that or are not tracking that, versus the therapist who's like, yeah, this is expected and this is what we do when this happens, or this is where we're going. You know, it's a certain level of skill, expertise, and depth of knowledge about trauma. So I wouldn't say don't go to a therapist who's trauma informed. You just want to, what does that mean, trauma informed? Like, so you know about trauma. What are your skills about treating trauma? What kind of things have you worked with? How do you think your trauma informed knowledge is going to help me and my issues? Right? Like, what do you think?
There's not necessarily like training that you would go through specifically to be trauma informed. It would just be like, I read The Body Keeps the Score.
That's one of the ways. So I would say, like, to become a really good trauma, no, that's a good question. To become a really good trauma therapist, I think there's a few things, right? I know I did a training at Hebrew U for treating complex trauma, and it was like a year program. And then there is a post-grad training in the city, the Institute for Contemporary Psychotherapy. They have a 2-year trauma training program, but none of them are like, it's not like then you're a trauma therapist, or people do these online trainings and it's like, I am a certified trauma therapist. Like, becoming a trauma therapist is an ongoing process, and it's so kind of reading like The Body Keeps the Score. I think it's reading as many books that you can get your hands on about trauma. You need to have an exquisite appreciation and understanding as well as how trauma impacts.
So I could be
people.
a trauma coach because I read The Body Keeps the Score.
Yeah, you could be a coach.
Okay. Trauma informed
Rebecca. I will come after you. You could be an amazing coach for healing your own self, my love. And you could be an amazing coach. Anyone could be their own amazing coach by reading great trauma-informed books. But seriously, no, here's the thing. I think it's people understanding what trauma is. It's not just about reading books. There's people who are so knowledgeable with books, but they are terrible because they themselves are so unintegrated in their own healing work. So I think to become a good trauma therapist, it's like, you have a lot of knowledge, right? Because good therapy is science and art together. So science is knowing the knowledge. Art is really blending like your own heart and soul, and being able to really connect to the person's pain and also their capacities to heal. It's never just knowledge.
Shoot, I should have written that down. I want to do that
blurb.
Well said. Yeah.
Okay, so rewind.
Yeah.
No, but basically, so it's a blend. So it's kind of like the person's humility and their like humbleness and their own healing work or their own supervision together with the knowledge that they have. So it would be that. That's trauma.
So
but I think it's also like a lot of, so I would say honestly, it's a lot of like, it could be also specific skills like EMDR skills. It could be sensory motor skills. It could be IFS training. It could be expressive arts. It could be.
So that would all be trauma informed.
So those are trauma informed, but you want to have someone who also gets like great consultation and has like a really robust understanding of the knowledge in their head, but also in their heart. That's the science. That's the art piece. Like you need that person who has like a really well-rounded approach to understanding trauma and how it impacts the person. And then the specific trauma could be like neglect, abuse. It could be any kind of specific situation. But yeah, I would say someone who hasn't, like there's people who talk about like trauma knowledge or trauma trained. So you want to look at like, what does that mean they're trauma trained? So it's a bit more complex. Maybe we should do like a blog on this, actually explaining the difference.
Yeah.
Because I think I would come up with like a more eloquent answer, but I'm not coming up with like a clear one right now.
Because I think that was asked more than once about what does it mean to be trauma informed versus like.
Yeah, because there's a lot of people who are trauma informed and they would not do good trauma work. I think they would know. Like, I've had so many therapists reach out to me and they kind of have a sense because they're not helping clients or they're getting confused. So they kind of know they're trauma informed, but they're not really helping clients. And I really respect those people when they reach out because it's like they're on their way to becoming really good trauma therapists. But they realize like that they somehow are like, there's a lot of information or a lot of, there's a gap. A lot of people get consultation. Yeah.
So somebody just asked about psychodrama, but I just want to say, so I know we're running out of time, and but Esther Goldstein is going to have a whole on her website in the next few days, a whole slew of like modalities, like kind of giving more information about all different types of therapies. And I don't know if with psychodrama was it one of something? Well, you're not
under the expressive arts. Yeah, I'm gonna have like there's psychodynamic psychotherapy, CBT, DBT, IFS, somatic, attachment focused, EMDR, and expressive arts. So psychodrama is one of them, actually. Right, you're answering this because people ask questions about modalities. So I'm going to be writing information that's going to be out there. There's going to be like written information and a little video about all the different kinds of therapies. I think psychodrama could be amazing. I think it depends on the kind of therapist, and I think it depends on what you're wanting to heal. And if that's your method of healing, I think it could be incredibly healing. Obviously, psychodrama could be really helpful to act out or through something that, on an unconscious level that comes out when it's not just talk therapy.
It's kind of like a drama IFS?
Kind of. So you're kind of, all of the therapy methods kind of borrow from each other. It's kind of like an acting out parts. Yeah, parts or an enactment of parts or a person or, so like an internalized, kind of like an introject. Oh, I don't want to go into this whole conversation because I'm, psychodrama could be amazing. You can process through and act out or work through some really deep stuff that you've been carrying on your psyche. Is an eating disorder a trauma?
We'll post about all this, so we don't have to.
Yeah, we'll keep them posted. Exactly. We'll keep you guys posted. We'll get an update. Is an eating disorder trauma? It is a trauma. It's a trauma to the body. Whatever happened that led up to the eating disorder is something happened to the body or the mind that then caused the body to have to use an eating disorder or disordered eating to cope. So something happened. I don't want to have to call it a trauma, but something was missing an equilibrium. And then the experience of the body going through an eating disorder is traumatic because then the body feels kind of attacked or neglected or abused, not on purpose, because really the eating disorder is trying to keep you alive in some way. But it could be traumatic. So there could be a part that feels kind of attacked or hurt and another part that could feel like confused or so. Yeah. Sus, Illy, I would love to answer your question more all about eating disorders. But yeah, the body could experience it as a trauma, and there's a way to work through and with it, actually. I would take a parts approach and then also work with the body in that way. Should we answer one or two more questions and then we're going to wrap?
Yeah. So
how do you know if therapy is just not your thing? Should we go with that one?
Yeah. Why not?
Like, I have tried so many different therapists and none are working. Maybe I'm just different. Maybe you are. But if you're asking the question, it makes me think that maybe you're not, or maybe you are different, but therapy might still be helpful to you. Look, therapy is not for everyone, and I don't think everybody needs therapy at every point in their life or even at any point in their life. I think it's specific. I don't know your question. I don't know who asked the question. I don't know if the person is on, but I don't know if therapy is your thing. It depends on why you were reaching out. So if you're going to tell me, if I understand the reason of why you were reaching out, then I might better be able to tell you, like, did you maybe just go to therapists who didn't understand your issue? Do you need help clarifying what your issue is? Or did you not meet a therapist who fully understood what the difficulty is, and then you didn't start feeling symptom relief? Because if you didn't have a clear understanding about the issue, or if therapist didn't understand you, then you didn't feel like it's working. And I also would want to understand what it means that they're not working. Or did it start working, but the issue is really big and it started chipping away one layer at a time, but it's kind of frustrating for you. So that's a hard question to answer.
Also, not all therapists are the right match. So
I was going to say, it could be that it's the wrong therapist match. It could be that, I don't know. Meaning, like, I would tell the therapist, I don't feel like therapy is working. And that's a conversation I have in my office many times when clients say, like, is therapy working? Or how do we know if therapy is working? I usually ask clients, like, how am I going to know that therapy is working for you? I mean, I kind of have a sense, but I want clients to know if therapy is working for them. I know if therapy is working for me. I know if my consultation is working for me. I know if the trainings I'm going to is working for me, So I would have to understand better about your experience with therapy, why you want to go to therapy. You can ask more questions after if we didn't fully
There was
answer.
another question about kind of being traumatized from therapy and as a
Oh, really?
child. And
Yes,
then,
yes. What did somebody write? What was it? That someone had a bad experience as a child. They were forced to go to therapy, right? And then they weren't sure if they should go as an adult. I can't find the question. Do you have it?
so I just like, my printer's not working, so I just
My
like jotted
parents made
down
me go to
notes.
therapy when I was younger, and it was so traumatizing and unhelpful. My wife wants us to go to therapy, but I feel like it will re-traumatize me. I've worked so hard to bury all my baggage, and I think it will make things worse. How do I explain to her therapy is not for everyone? Wow. First of all, I'm so sorry that your parents took you to therapy and it was traumatizing to you and unhelpful. Double, double. Ugh. Your wife wants to go to therapy. Why does your wife want to go to therapy? And I don't know if it will only re-traumatize you. So I would be very, first of all, I'm not telling you you should go to therapy. You reserve the right to say, at a point in the past, I was forced to go to therapy. I don't want to go to therapy right now. Separate from that, I would say to your wife and say, darling, how come you want to go to therapy? Because my sense is there might be something really valid going on between the two of you that needs some help. Then you want to talk to her. She can start by going to someone by herself. And then she could tell that person, my husband really was traumatized, or whoever your partner is, by going to therapy in the past. Is there a way that you can talk to me or talk to the two of us so it could be a safe way for us to do work together? And why am I saying this to you? You worked hard to bury all your baggage and you think it will make things worse. So you might not like what I'm going to say, not because I don't want to be helpful, but none of us are very good at burying things. If I bury something, you know the game with like the, what is it, the alligators? You know, like when you go to these arcades and you bop down the, are they alligators?
Oh,
Or
right. And then another one pops up.
another
The
one pops up.
mole.
So you're
The
kind of
mole.
the mole or the
The mole.
alligators, either
Mole
one.
whack-a-mole.
Right, the whack-a-mole, okay? So this is what happens because any of us who have baggage is like it never ever ever goes away. It always has to come out. Now it might come out like you might think that you have the baggage that's gone away, but it might come out with like maybe you're being passive, maybe you shut her down, maybe you got I don't know what's going on, but it comes up somewhere. I'm not telling you you need to go to therapy for the rest of your life, but usually the stuff that we carry is going to bop up somewhere. And maybe that's related, it might not. Maybe it's related to why your wife wants to be in therapy with you. Maybe she
Could you
feels like
explain what re-traumatizing
yeah,
means
yeah, yeah, yeah. Let
more?
me just say this. So my sense is that so first of all, I just want to say to this guy, um, I understand why you'd be afraid of being re-traumatized. A good therapist would not open all your baggage and flood you. Re-traumatizing is basically if you go to a therapist who A doesn't understand you, kind of forces you into talking about things, opens up all of your issues way too quickly, or kind of, disarms you or yeah, kind of pulls out all your issues, takes away any of your defenses, really doesn't connect with you. It could be a traumatizing experience is when a therapist is really traumatic, kind of when you're forced to do things and you don't want to. Things are pointed out that kind of are harmful, that that the person says something to you in an attacking way. So this guy's really worried that, and he's done a good job to bury his baggage. Now, I would say, just like I said, okay, you can't push things away. At the same time, even if, like I'm saying, it's always bopping up, you have a right to say, I don't want to look at that. You have a right to say, I don't want to look at this deep stuff. There is so much baggage. It's too scary. You know what? It might be impacting my marriage, but you know what? Like, I need a therapist to not go there right now. Like, you could work on your marriage without having to go into all of that baggage, so to speak, because it could be too dangerous and too frightening for you to go there right now. So that's what I'm saying. Re-traumatizing is if a therapist says, no, we have to work through all of your baggage or all your stuff from the past in order to do the work.
But would a therapist need to go
No, somebody
through
else asked
all of
that
that?
question. No, so a
Oh,
good
right. Somebody
therapist,
else asked that question,
right?
right?
So a good therapist would actually say, you know what, like, let's hear what you want to work on. And they might say, like, look, my senses might be related to some stuff that I know you have very tightly packed. Like, I have clients who say, like, there's things we could talk about, this and this we can't talk about. And I always say, like, wait, these two things are packed up. Remember, I'm not allowed to go there. If it changes at any point, you tell me, but this feels connected, but we're not going there. We're going to go to whatever. So no, a therapist can help you without going to the core of the issue that's there or to your baggage that's very tightly wrapped because you need it to be wrapped right now. Clearly, it feels too
It's
dangerous.
protecting you, right?
It's protecting you. And if you don't feel safe enough or if it doesn't feel right, you don't have to go to all of those issues and like go through the rubble. Because somebody asked, do I have to go through all the issues? No, there's many different kinds of therapy. And there's many different kinds of therapists. And even a therapist who does usually do deeper work A skilled therapist is not going to go there. It's going to tread much, much more lightly and could help you experience huge symptom relief, even without going through that. So to this guy, I would say, like, you have a right to say, I don't want to be traumatized. I don't want to unpack all my baggage. It's too much for me. It's too scary. I'm going to fall apart. And he does have a right to say therapy is not for me. Like I just said, he has a right to say that. He could say, like, listen, my dear, how can we work on this issue in another way? Or can I help you? Can I support you? Can we look at this without, uncovering this because it's too frightening to me? And maybe telling your wife a little bit that you really needed to package this away and it's too concerning to you for right now. Maybe sometime in the future, maybe not. But you're willing to help work on the marriage in another way. Because it's not going to work, even if everyone's saying go to marriage therapy. If you're feeling too frightened or that you're afraid it's going to re-traumatize you, it's not going to work. Is it possible you meet a good therapist who could go really slowly and not, jeopardize your protective system? It's possible. But I think the first thing would be safety for her, but also